Hey guys, welcome back to our channel Medphonics Talks. Today we are going to discuss about the topic joints. You can see I have written in the board about the explanation of joints. Joints is a connection between two bones in skeletal system. You know that we need a connections between bones, right? We need to connect a bone to another bone. This connection between the bones is known as joints. And according to our anatomy, basic anatomy, there are two types of differentiation or two types of bones we can classify into according to the tissue they are from and degree of movement, according to how they can move and what is the direction and these kind of things. So there are two types of joint according to the classification of tissue and the degree of movement. According to tissue, we have three types of joint. First one is fibrous joint, cartilaginous joint, synovial joint. According to the degree of movement, there are three types of joints: synarthrosis, amphiarthrosis, and diarthrosis. As I told you, arth means joint, like arthrology is a study of joints, and synarthrosis, amphiarthrosis, and diarthrosis. These are the two classifications of joint. So now we are going to start about the classification of joint. So before that, I want to give you a brief one sentences, like I want to give you a short type answers for each and every kind of type of joints. First one according to type of tissue, and the second one is the degree of movement. First one according to type of tissue: fibrous, cartilaginous, and synovial. Fibrous, the definition is connected by fibrous tissue. So these type of bones like cartilaginous joint, fibrous joints, those joints are connected with the help of fibrous tissue. The next one is cartilaginous joint, and they are connected by cartilage. Then synovial, I hope you already know about the synovial joint because they are having synovial fluid there. Articulating surfaces enclosed within fluid filled joint capsule. So inside the joint capsule, there is a presence of fluid, which is a synovial fluid. Next is according to the degree of movement. First one is synarthrosis, the next one is amphiarthrosis, and third one is diarthrosis. Synarthrosis are immovable joint, they can't be movable each other. In amphiarthrosis, they are slightly movable. They are to an extent they can be they are movable, but after that they can't. And diarthrosis are freely movable. These movements are mostly seen in the our basic joints like knee joint, and all. We will focus that on later. So now we are going to start to talk more about fibrous joints. So now I am going to technically explain you each and every joints more. So fibrous joint, they are immovable and tough. Okay, they are immovable and tough. And there are three next classifications. There are sub-classifications of fibrous joint like sutures, gomphoses, and syndesmosis. You know what is sutures? Sutures are found in our skull mostly, and they are immovable. They are synarthrosis. I have told you, right? According to degree of movement, immovable joints are synarthrosis, and slightly movable are amphiarthrosis, and freely movable are diarthrosis. So they are immovable, like they are synarthrosis. They can't be movable, and they are found between the skull. So if this is a frontal bone, if I am going to draw you about the frontal bone, this is frontal, and here will be the parietal, and between this frontal and parietal there is a presence of sutures. These are sutures. There are many sutures like sagittal suture, parietal suture, coronal suture. So these sutures will be in between the skull. So these bones, these joints are seen between the flat bones, and they are up to 20 years. Up to 20 years of age, it will be moving, and after 20 years, it will be fixed, and they will be ossified completely. Okay. Next one is gomphoses. They are immovable. They are also immovable between the socket of teeth. So if this is a gum, this is your teeth gum, and here the teeth is there. So the joint between the teeth and this gum is gomphoses. And there will be a ligament which will be holding the teeth and the socket or that gum. This ligament is known as periodontal ligament. This is very important, need PG question also. Periodontal ligament will be holding the teeth and the gum or the socket, holding very fixed. The next one is syndesmosis. Syndesmosis are slightly mobile, which is also called as amphiarthrosis. And these bones will be having interosseous membrane. You know, there is a radius, this is a radius, and this is ulna. Between the radius and ulna, there will be a presence of interosseous membrane, and these type of joints are syndesmosis or syndesmosis joint, we can tell. So these are the sub-classification of fibrous joint. Next, we are going to talk about cartilaginous joint. So now we are going to start about next bone, which is cartilaginous joint. Cartilaginous joint there are subclasses like two. These cartilaginous joint, neither they will be made by hyaline cartilage or fibrocartilages. So these type, they are having different two types, synchondrosis and symphysis. Synchondrosis are a primary cartilaginous joint and symphysis are a secondary cartilaginous joint. So synchondroses are formed from hyaline cartilage and they are immovable, which is also known as synarthrosis. And these synchondroses can be seen between diaphysis and epiphysis. So diaphysis and epiphysis. These diaphysis and epiphysis are seen in the growing bones. Okay. So if this is a tip of a growing bone, suppose this is a tip of a growing bone, here this is the diaphysis and this is the epiphysis. This is epiphysis and diaphysis. Don't need to get confused. If you are taking a long bone here, this top portion will be epi, or the two end will be epi and the mid portion will be diaphysis, or the shaft or the body is diaphysis and the epiphysis will be seen in the end. So here will be like epiphyseal plate in which they will be growing, and this epiphyseal plate are synchondroses or primary cartilaginous joint. Next joints are symphysis, which is also a class of cartilaginous joint. These are fibrous cartilages, fibrocartilaginous joint. They will be slightly movable. They can be moved to an extent or they can stretch each other. So these slightly movable joints are known as amphiarthrosis, and examples are pubic symphysis and intervertebral disc. You know that's pubic symphysis, right? This is a suppose this is a hip joint, and in hip joint there are connection here, and this connection is known as pubic symphysis. So these will be anteriorly seen, and if you are holding the hip like this, and here the meeting point will be the these cartilaginous joint which will be connecting to hip joint anteriorly, and next one will be intervertebral disc. If you are taking one vertebra, this will be suppose one vertebra and the second vertebra. So in between there will be a presence of disc. As you know, there is a presence of disc, and these joints are also example for symphysis. And these discs are known as intervertebral disc, which will connect between two vertebra, which will reduce the friction between the bone. Okay, these are about the cartilaginous joint. So now we are going to talk more about synovial joint. These joints, there are so many joints in synovial joint. There are around 6 basic joints. First one is hinge joint, hinge, saddle, plane, pivot, condylar or ellipsoid, and the ball and socket joint. Hinge joints, they are seen in elbow, knee and ankle. So I will talk about the elbow joint now. I have told you the movements of anatomy. In anatomy there are movements, right? Flexion and extension. So this is like a door hinge. These represents the joint, hinge joint, and the example are elbow joint, which is in the hand, like our upper limb, then the lower limb, knee joint and the ankle. This will only provide flexion and extension movement. Next one is saddle joint. They are seen in carpo-metacarpal joint. Carpals, you know that they are seen in the wrist, and metacarpals are seen in the palm region. So here will be the wrist and here will be the saddle joint, carpo-metacarpal joint, and these joints are seen in between the carpals and metacarpals. These are metacarpals and this is carpals. You can see the thumb. These are saddle joint. Then next one is plane joints. They are seen in the acromioclavicular joint. Acromion process is seen in the scapula and the clavicle here. Here there will be a joint, and this joint will be plane joints. I will talk about this when you are studying about the clavicle and the acromion process. Next joints are pivot joint. Pivot joint will provide the movement in the neck. Mostly the pivot joint example is the skull, or our vertebra and the skull. First one is atlantoaxial joint. Atlantoaxial joint means, you know that there are 7 cervical vertebra. Out of 7 cervical vertebra, first one C1 and C2. The joint between the C1 and the C2. C1 is the atlas and C2 is the axis. So the joint between C1 and C2, this joint is atlantoaxial joint. This will provide the movement of the left and the right movement. Okay. So these joints are pivot joint. It will be like a plate which will turn over it. So next one is proximal and distal radioulnar joint. So in the radius and ulna, there are proximal and distal radioulnar joint. There we can see the pivot joint. Next one is condylar joint, or condylar joint is also known as ellipsoid joint. These joints are found in the wrist. Condylar joint here, and between the metacarpophalangeal joint here, ellipsoid here. Then metatarso-phalangeal joint, which is also seen in the lower limb. So it is seen in the upper limb and the lower limb. So hinge joint, saddle joint, plain pivot, and condylar or ellipsoid joint. Next one is ball and socket joint. Ball and socket joint are seen in the hip joint and the shoulder joint. I have told you, right? We can freely move. This shoulder joint are freely movable, and this joint will be in a cup and a, I will show you. This is a cup and the ball here. These joints are ball and socket joint. It will be a cup, and the joint here, they will be rolled. They can move. They are freely movable, like a ball and a socket. These joints, there are two joints in hip and shoulder. Now I will give you a pictorial representation of all the joint with arrows and markings, so it will be easy to understand how you can identify these joints. So now we are going to see the types of joints in a pictorial manner. I have excluded a saddle joint because it's too hard to draw. It is a 3D view. I have 5 joints here: pivot joint, hinge joint, ball and socket joint, condylar joint or ellipsoid joint, then the pivot plain joint. First one is pivot joint. I have told you it is fine in the neck, right? It will be like it can be moved. Okay, suppose I can hold this part, I can move like this. Okay, in the left and right movement. So I can move here towards here and towards here, which is a left and right movement. Then next one is the hinge joint. Hinge joint will be like a door, right? So I can move this part. This is a holding part, and here I can move like this. Okay, to and from motion. These are hinge joint or flexion or extension. Next one is ball and socket joint. Ball and socket joint is freely movable, and they can be moved on any side because it's freely movable, which is like a ball and a socket. Next one is condylar joint. Condylar joint, I have told you, right? It is like a ellipsoidal manner, and it is also like concave convex surface, and it will be like a moving in a ellipsoidal manner. You can see there, which is seen in the carpals joint. Sorry, metacarpals and carpals. The next one is the plain joint. Plain joint, it will be like a plane, right? It can like in a joint in a plane or a flat surface. Next one is saddle joint. Saddle joint is actually a reciprocal of the concave and convex surface, and it is seen in the metacarpal joint, wrist joint. They are seen in the metacarpophalangeal joint. Sorry, metacarpal joint, carpo-metacarpal joint. So these are all about the joints. Next topic, we will talk about the questions of the joints, because this part is very important for your NEET PG. This joints question, at least you should know about this joint. We will see you on next video. Till then, bye.